we have a doctor on the line, and this is his area of expertise, so stay tuned, and he's going to answer our questions. We're speaking with Dr. Jonathan Aviv. He's an ENT. He's a clinical director of Voice and Swallowing Center at Mount Sinai Medical Center. Good afternoon, Dr. Aviv.
Good afternoon.
All right. Can you clear this up for us? Because, of course, this particular issue is making news because of what Michael Douglas has said. In terms of the cause of throat cancer, the predominant cause, would you say that it is smoking and drinking?
The prominent cause of HPV-related head and neck cancer? Is that the specific question?
Well, he says that he had throat cancer. He says the reason he got the cancer was because of the virus. But is that a common thing?
Well, yes. As it turns out, in the last 10 to 15 years, HPV-related head and neck cancer, specifically cancer of the tongue, cancer of the tonsil, cancer of the throat, is now much more the cause than in the, say, 20 years before that.
But how come, excuse me, Dr. Aviv, how come we're not hearing as much about it until somebody like Michael Douglas brings it up?
Well, how much did you hear about colon cancer until Katie Couric said something?
Right, that's true. That's true. But you hear more of that about that and the causes as opposed to what brings it on right now.
Well, in our world, we see this alarming shift in who's getting head and neck cancer from people in their 60s and 70s to people in their 30s and 40s who never smoked and never drank.
Right.
And the specific instance that you were referring to, when you have multiple factors at play, you have smoking, you have drinking, there may be oral sex too. All these things are part of what transforms tissue into cancer.
And it can lay dormant for many years for that to happen.
Correct.
Yeah.
Correct. 10 to 15 years is routine with this disease.
Right. So what he is saying now, even though he contracted the cancer in 2010, God knows when he did have this happen.
In other words, you're precisely correct. We don't know, no one knows exactly when that particular moment took place where the transformation of the cells happened. We don't know in time when it happened. It could have been as much as 20 years earlier.
So, in hearing this, what do you advise?
Well, it's like what we would advise anyone who is at increased risk for a disease. In the situation of HPV-related head and neck cancer, the risks are very clear. It's been studied. It's been published. One of the risks is number of oral sex partners. And they're very, very specific in these studies. If it's less than 5 lifetime partners, the chances of an HPV-related head and neck cancer is twice that of someone who wasn't in that situation.
Right.
If it's 6 or more partners, you're talking about a 5-fold increase. So these are well-established risk factors. So what I would advise someone who feels that they are at risk, it's very, very easy to get checked for head and neck cancer. A tiny little spaghetti with camera is placed via the nose, and you take a look at the tongue base, the vocal cords. The whole thing literally takes about 60 seconds.
Right.
And if we see something, we could actually do a biopsy right there in the office.
Okay.
You don't have to go to the operating room.
Right.
So the point is, unlike, say, an example, say, pancreas cancer, where it's a very difficult organ to look at, very, very difficult to assay what's going on, who knows what the risk factors are. Here in this situation, It's all in front of us,
well,
right?
Yes, indeed, and we thank you for joining us this afternoon, Dr. Jonathan Aviv, Clinical Director of the Voice and Swallowing Center at Mount Sinai Medical Center. He is an ENT, and we thank you. We're gonna take your calls, and even knowing what we know now about Michael Douglas, now kind of backpedaling, blaming oral sex for his throat cancer. Still, do you think he should have come forward to reveal this? 1-800-321-0710. I'm Hillary Barsky in for Rita Cosby. It's 521.
WOR, The Rita Cosby Show. 800-321-0710.